Welcome to Heart Healthy Living with Dr. Jackie, a Big Blend radio podcast that features Dr. Jacqueline Eubany, a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story. Welcome, everyone. Did you know the month of May is High Blood Pressure Education Month? And we all know Dr. Jackie loves to talk about high blood pressure because she doesn't want you to have it. So it's not a good thing to have, but it does affect a lot of us. And I don't know the stats on it, but I do know this, that it does affect our heart health. And heart disease is the number one killer of women in the United States, also for men. And it actually kills more women than breast and lung cancer combined. And so Dr. Jackie's here every second Wednesday with a new episode teaching us how to reduce our risk of high blood pressure, which leads to heart disease by 80%, so that we can live long and happy lives. And that is also documented in her book, her best-selling book, Women and Heart Disease, The Real Story, which is out now. Go to Amazon, all those places. So Dr. Jackie, how are you doing? Welcome back.
I'm doing well. Thanks for having me. I'm always happy to be here.
We love it. And I know you wanted to talk about high blood pressure. I said, hey, Dr. Jackie, do you want to do this topic again? And you're like, yes, this is important, right? High blood pressure for us to understand it. And I wanted to just actually really start with, if we can go into what it is. We all hear the words hypertension, high blood pressure, and oh, my blood pressure was this over this. And when people start giving me the numbers, I'm like, all right, I don't know what that is. Like, you're making me do math in school again. I don't want to do that. But seriously, I don't ever need to do that again. And the trigonometry and the algebra, no, nope. You can keep it. But, you know, as soon as I even think about trigonometry, I can feel my blood pressure change. But yeah, blood pressure, you know, I always thought it was as we age, it starts to happen, but I actually see a lot of younger people getting high blood pressure, which kind of makes me curious as to why and what it really is, what happens to our bodies.
So high blood pressure is a very common illness. It's very common in the United States. We see over 1.2 billion adults in the United States are afflicted with this illness. And what it is that your blood vessels are very stiff and the pressure in it is really high, such that when your heart is trying to pump against a very stiff blood vessels, the pressure goes up, which causes the heart to work a lot harder than it normally would. So if you just think about, you know, the heart pumping against a balloon, where if it pumps, you know, the balloon is compliant and can receive all that pressure and dilate and translate that pressure downstream. But when you think about the heart pumping next to a pipe that's stiff, you can see that the heart has to pump really hard to get that blood pressure, to get the blood forward, and that pressure doesn't translate as quickly. And that leads to the heart working very hard to pump against a stiff blood vessels, and it can increase the pressure, increase the work of the heart, and cause a lot of complications all throughout the body.
So basically, you put your heart into overdrive, but you're not supporting it. You're taking away its support. You're in overdrive. You know, it's like not giving your car an oil change. The car runs out of oil, but you're trying to go up a really steep hill at a fast pace.
That's a way of looking at it. Yeah.
Well, that made me tired just thinking of it. I'm like, you know, my car's getting old, and she's on this grand adventure across the country, you know, with us traveling full time. And I don't want to give up on her. She doesn't want to give up on our tour, but sometimes I have to go, you know, be kind to your car. And it's the same with our bodies. You know, it's sometimes I think we take better care of our cars than our bodies, you know, just.
Yeah, that is the truth.
Yeah, we'll go get the oil change, but do we do that for ourselves, you know? So high blood pressure I don't know if it's just, you know, me knowing a lot of people that work real hard and maybe it's stress of today. But I just always thought it was something that people get at a certain age. And now I'm starting to think that's not true. Am I right on that? Or is it just the people I know? What's happening?
Yeah. I mean, high blood pressure can be genetic, and when it is genetic,
Okay.
you can see it at a younger age. It is associated with risk factors. We talked about that. We've talked about this multiple times. Risk factors for coronary artery disease, like obesity, physical inactivity, excess alcohol. So these things can increase your risk for high blood pressure and can cause you to have it at a younger age. But as we do get older, especially as women, as we go through the changes of life, like menopause, we are also at higher risk for high blood pressure because of the lack of hormones and the stiffer vessels.
Oh, wow. So for women, this is a big deal. So because I've heard like, because people do like hormone replacements and things, right? I don't,
Right.
yeah. And I've got friends who are going through things and I'm like, I'm ignoring whatever's going on, whatever's happening. I'm kidding. I know you're going to come after me later on that, but no, but I think everybody's body is different. But I
Yeah.
do know that like my patience level as I age isn't as nice as it was in earlier years. So I wonder about that. Sometime I'm going, okay, are you overdoing things if you're getting snappy about things? There's things to be upset about. There's things to be snappy about for real, right? But I also go like sometimes where if there's like a little overreaction, I start to wonder where that comes from. If it's like you need to get another night's sleep or something, or if you're doing too much and stressing out, then you're likely to snap quicker. You know what I mean? And not have that
Yeah.
patience.
Yeah.
So I think we all kind of get that. And I think as we get older, that's kind of there anyway, because you get tired of certain things in life. You just don't waste my
Yeah,
time.
it sounds like you're describing stress. When you
Oh,
stress, when you are stressed out, you tend to snap, and we know that stress is a risk factor for hypertension. So being under a lot of stress, and if you find yourself snapping all the time, and it can
mm.
increase your risk for high blood pressure.
Because that's what I think about the younger generation having it. I think our younger generation is a lot more health conscious than when I was their age, right? Just even, not drinking as much, or at all. And being more like healthy in the physical way and, you know, working out and all of that kind of thing. I feel, and even being more health conscious of the food. So I feel like we're really better, but then I also think the stress level isn't being checked out as much because they take on so much.
Yeah,
There's teens with businesses, that are more successful than elders. You know what I mean? It's like kind of an
right.
interesting world. Are you seeing changes happen with all these apps we have nowadays with like we can check our blood pressure on an app or these kinds of things. I mean, there's real blood pressure things like we can get into that, but with apps and checking how your heart rate is when you're running and things like that, do you think this is all helping with being more connected to our body, these kinds of apps?
Well, I mean, I think it is, helpful because from a cardiac standpoint, you're able to diagnose what we call arrhythmias or abnormal heart rhythms earlier with these apps, but not such a close correlation with hypertension. Because hypertension is a silent killer, and a lot of these apps don't measure. Well, the ones on your phone anyway do not measure blood pressure. You would have to specifically buy one of these cuffs that they sell at CVS or any kind of drugstore and check your blood pressures at home. That would be the only way you could tell that you have high blood pressure.
Okay, so you talk about getting that in, and normally that comes once you've been diagnosed, right? And I remember, like Nancy, my mom, she has white coat syndrome. And so whenever there's any kind of medical thing, it is not easy. Um, no, it is not. She ended up in the ER at a dental visit just because of the anxiety of it all. And she spiked and went in, and then she turned out to be pretty okay, but it was, and she lived, and she got, very scary because it was a hypertension, and she went way off
Hmm.
the charts. Her
Hmm.
eyesight changed. And that's something that maybe we should look at too, because doesn't your eyesight kind of let you know you're in danger zone if things start to get blurry?
Yes, your eyesight can be an indication that your blood pressure is extremely high, and that's usually when it's really, really high, extremely high. You can have blurred vision as a manifestation of extremely elevated blood pressure. So not just blurred vision, headache, and overall just not feeling well.
Mm,
So yeah, those can be indications, but those you tend to see in patients who already have the diagnosis. But a lot of times people don't even know that they have high
hmm.
blood pressure, and when they have these symptoms, they're unaware that it's associated with blood pressure, and a lot of times they don't get that checked out, so that makes that difficult to diagnose.
So high blood pressure, direct relationship to possibly stroking out and having a heart attack. Those two things could actually happen if you ignore these symptoms, right? If you don't go to the ER, like with her having that blurred vision at that time, it was scary, man. The dentist
Yes.
was like, "We're not doing this." She had like I don't know if it was a root canal or whatever, and she's like, "You're going to the ER," and I'm like, "What the heck, man?"
No,
That's
absolutely.
scary. But I mean,
Yeah.
and I know she's fine with me telling this story because she is not alone, as you were saying. I mean, this is something so many people go onto it, and then she works so hard to not have to be on medication, and they gave medication and checked in. Is it good? Is it working for her, and all that kind of thing. And she was able at a point to actually not be on medication, and then things change in life, but as we all age and things happen, but she really reversed it. It was dedicated, like, the whole household had to behave themselves. Like, she's like, if it's good for me, it's
Yeah.
good for you. I'm like, okay, let's go. It's a
Yeah.
journey,
Yeah, it
and
is. It is.
real journey. I mean, what we ate, we walked, like you would, I mean, we just walking and health, the diet, those two things, I think changed so much for that.
Yeah. Yeah. No, I'd agree. So those, you mentioned some of the causes of blood pressure, of hypertension, as you're giving the story about your mom. We know that risk factors for hypertension include things like physical inactivity, excess eating, obesity, increased salt intake. Um, so you can help your blood pressure by some lifestyle modifications like you and your mom try to do, decreasing the salt intake, eating healthier, losing some weight, increasing your physical activity, cutting back on alcohol. So all these things can help lower your blood pressure.
Mm. Yeah, I think the salt intake is difficult.
Yes.
That is, but like I think because yeah, it's difficult. But you can get things that instead of there's like salt, like you can do things without salt, and it can be kind of salty. There's like substitutes for these things.
Yes, there absolutely is.
And
There really
herbs do a great job of it. And just eat celery, you'll get salt.
is. Yes,
Yeah.
no, I like the whole herb things. You can, spice your food up or season your food with herbs. You don't necessarily need to put salt in it to bring out the taste and the flavor.
Yeah, and it takes time. I mean, the beginning it sucks. Let's just be honest, right? It sucks in the beginning, right? And I remember when I went vegan, I did it to clean my body, and it worked until I started doing the processed vegan food. And so
Yeah.
now I really realize that all processed food is really not good for us. But when we really did that, it's so interesting because even now, like we'll go to a friend's house, we'll go, hey, I'm going to make you this dinner, and Nancy and I look at each other like the amount of salt or sugar, especially if they
Mm-hmm.
smoke, right? That
Oh,
sometimes
good heavens.
their taste buds sometimes for everyone's different, and I'm not knocking, but like um, so our taste changes. So even if you go
Mm-hmm.
to a restaurant, sometimes the food is so much more saltier than what you're used to. Once you get trained, you train your body, and it actually does not take that long to do, especially if you drink water, because you change out. I don't know how this works, Dr. Jackie, but I've really realized the value of water. I mean, our body is what, 70 something percent water. So if we're not like, it's like we need to clean our body out by putting fresh water in so that the dirty water goes out. That's why we pee, right?
Yes.
Just we
No,
pee and
water.
sweat for these reasons. And then you need to replenish it, because that's you. Do you want a nice juicy grape, or do you want to be a raisin? I want to be the grape.
No, water is definitely, yeah. I mean, everything you said is true. Water is very important for our body. So it's important that you're drinking 8 to 10 glasses of water a day, because that helps you stay healthier.
Okay, well, this is the thing. There's little tricks out there to do this, and you can have fun with it, especially cooking. You know, I'm
Yeah.
learning. I've been learning to cook, and to me, it's like, you know what? It's worth it. And then you can find things that are simple and easy. And if you're in the mood to cook, cook up a whole bunch of stuff and freeze it for the days you don't
Yeah.
want to. Like, there's
Yeah.
things you can do. Hmm.
Yeah, I like that as a healthy eating hack. Cooking in big quantity and putting it in the freezer, and then you're able to thaw it during the week so that you don't have to think about, what you're going to make every day. Especially if you don't have a meal plan, you're more likely to deviate from your diet and eat unhealthy things. But if you want to stick to a healthy diet, it's definitely a good idea to plan your meals, which can be difficult sometimes, but maybe cooking in bulk and freezing it so that during the week you don't have to think too much about what you're going to eat. Just take it out of the freezer and eat it.
And you can do that even with like your fruit. Some of your fruit you can freeze, especially when we get into hot months. Grapes, I'm going back to the grapes. Freeze them. They make, oh my gosh, it's like a treat in summer. Frozen grapes and things. Yeah.
Yeah.
Blueberries. Okay, so what about these berries when everybody talks about antioxidants, and you can get them in certain, fruits and vegetables, like fruit, like, um, does that help in high blood pressure? Does antioxidants help in high blood pressure, or is it just generally good for us?
Yes, it's generally good for overall cardiac health. Antioxidants found in fruits and vegetables are, good for overall cardiac health.
Okay, so and walking. So let's have berries when we walk, or afterwards, So this is good stuff. Now, what is your word of the month? Because I thought you were going to go hypertension, but I know we've done that before. I know you like to talk about this high blood pressure stuff, but
Mhm.
oh, before we get to that, I wanted to ask about medication. So, like Nancy got herself reversed off of having to take it under a doctor's supervision, right? This was many years ago, and she really, I mean, it is, I mean, it's possible, right? And then at times, the medication, some people don't want to take it. And then if you don't stick to that plan, you may end up back in that zone. So how
Mhm.
important, I mean, where is the level of the medication things? I mean, I've heard things like you can get off of it, get off of your medication if you eat enough beets. I don't know how many beets you have to eat to get off your medication, but like, I don't know. I think beets are very good for our heart health, but, and I've heard some good things about it, but, that should be supervised, right? Because you can't just not take a pill without it having an effect on your body. You know what I mean? Shouldn't that be
Yeah.
watched over with your
Yeah, no,
medicine?
no, absolutely. If you do have, when you're initially diagnosed with hypertension, depending on how severely elevated your blood pressure is, your doctor can give you a 3 month window to implement some lifestyle changes, so that you can, decrease your blood pressure on your own without medication. And some of these lifestyle changes are the things we talked about, like walking, exercising, just physical activity, cutting out the salt in your diet. We always say if you're hypertensive, you should only be eating about 1,500 milligrams of salt a day. You want to cut out any excess alcohol. You want to quit smoking if you smoke. So the usual things. So you can try this out for 3 months. But if your blood pressure remains elevated despite implementing all the lifestyle changes that you're able to, then you get started on medication. There's nothing wrong with being started on medication. Sometimes, lifestyle modifications may not be successful in decreasing your blood pressure to the level that's considered safe. So
Mm.
yeah, so that is definitely something that can be done.
Okay, so you this is really good, important stuff about the medications help you, and then you can get yourself balanced out there. But you talk about the levels, right? So I wanted to touch on that. What are healthy blood pressure levels and what is unhealthy? So we can understand that.
So normal blood pressure, according to the American Heart Association, is when the systolic number is between 120 over 80 or less is considered a normal blood pressure. And if it's higher, like between 120 and 130, the top number, the systolic number, then you're considered, your blood pressure is high. And at this stage, it is perfectly okay to try the lifestyle modifications like the exercise and all those things that we talked about. So that's considered stage one hypertension. Higher than that, 140 to 130 to 140 will be considered, stage one hypertension, and the guidelines generally recommend medications. So the higher your blood pressure is you more than likely you are going to require medications to bring it down to a normal level.
Wow. Okay, so yeah, and then you can still, if you get yourself clean and healthy, this is the whole thing is about trying to not have this. That's the importance.
Yes.
So is there a specific age? We were touching on that earlier. And so when we go through that life change, ladies, when those extra pounds won't come off, I swear to God, the day you turn 50, the next day, it's there. That tire just comes out overnight. It said you ate cake on your 50th birthday. You had more than one glass of wine, maybe did a shot of tequila, and I'm here to stay with you until you really do something. But is there when should people start to check on their blood pressure? I mean, if they're feeling stressed out, should they go get a blood pressure kit and start checking it?
No, I don't think it's ever too early to start checking your blood pressure. Checking your blood pressure. If you have a regular doctor's visits, like once or twice a year, that's a good place where your blood
Okay.
pressure is checked, and you can be screened that way. But if you have a family history of hypertension, then I would recommend that you buy one of these blood pressure cuffs from the pharmacy store and start checking your blood pressure at home, once every few days to see where your numbers lie. Because the
Mm.
earlier you get diagnosed and you find out that you have high blood pressure, the better your prognosis is, the better you are to do long term.
Do you think we should have one in a first aid kit in general?
Well, not in a first aid kit. I would say just having one at home would be good.
Okay.
The first aid is supposed to be emergency, what do you need right
Okay.
away. So I
Okay.
wouldn't consider this like an emergency, what you need right away. But you should have one at home, especially if you have a history, if you have a strong family history of high blood pressure
Okay. Or even heart disease, right? If
or
you have
even heart
heart.
disease. Yes.
Okay. Okay. So okay. So that's a good thing to have. And then I brought up the first aid part because can't if something has happened to you, like in an emergency, can't that spike your blood pressure and give you hypertension, high blood pressure over pain or
Yeah.
fever
Yeah.
or something like that? But it wouldn't be necessarily something that's like a one-off thing. It's not like it like that doesn't mean it's going to stay with you after that
Right.
incident is over, right?
Yeah, you can have situational events where your blood pressure spikes unusually. And that's why we don't base the definition of high blood pressure on one reading. Usually, your doctor, if they flag that one of your blood pressures in the clinic is elevated, they usually recommend that you get a blood pressure cuff and measure your blood pressure at home. So it's through the series of blood pressure recordings that you've written down is where the diagnosis of hypertension comes about, but not
Hmm.
just one reading.
Ah, okay. This is good stuff, man. I'm glad we're doing this. Okay, the word of the month, because I think we hear about this all the time, and we never really quite get it. And if if you snore, you may want to hear this part, right?
So yes, my word of the month is obstructive sleep apnea. So this is when you have a pause in your breathing during sleep. So we usually see this in obese patients, but you don't necessarily have to be obese. But you have an obstruction in your airway when you're sleeping, which leads to snoring, which leads to decreased oxygenation throughout the rest of your body, which triggers stress and a stress response. And this can lead to high blood pressure, high heart rate. It can worsen hypertension in people who have high blood pressure, and it can cause hypertension because you're in a stress phase and your body's really struggling for oxygen. And it can also lead to arrhythmias, either fast heart rates or slow heart rates. So, like you mentioned, you initially get flagged as possibly having obstructive sleep apnea if you're snoring really loud at night, or your partner notices that you tend to stop breathing in the middle of the night, or you're gasping for air. So things like that, or being fatigued during the day, because when you're sleeping with obstructive sleep apnea, you're not getting adequate sleep, and you think you are, but the next day you tend to be more fatigued because you really didn't get enough sleep. So definitely fatigue, or we call hypersomnolence, is just really tired during the day. And gasping for air is a way to flag a patient as possibly having obstructive sleep apnea. And
Oh,
from then,
wow.
there
Yeah.
you get to be screened to see if you really do have it.
Well, it's not even the sleep. I mean, if you're gasping for air, doesn't your body kind of panic when that
Yeah, so
happens?
it's a stress. Yeah, your body goes into a stress response because you're not getting enough oxygen, and so you think you're asleep because you're unaware of all of this happening. But your partner can see it and knows that it's happening, but you experience just fatigue during the day because you're not getting adequate sleep at night.
Wow. Oh, okay. Well, Dr. Jackie, I think I'm going to go eat some blueberries and go for a walk in the sunshine at this point. Yeah. Well, I think, this is just all, I just think we've got to be aware of it, because this is like that step towards having heart disease. And you know what I mean? When we look at high blood pressure, it's a step
Yes,
towards a heart attack, heart disease, a stroke, which can be debilitating, you know?
absolutely, absolutely.
Yeah, a dear friend of ours, her husband had like he, I don't, this is amazing to me, had a stroke,
Uh
but it was a
huh.
clot. It was like a blood clot thing that was happening. And they were actually driving. And luckily so he was already in the car. She took him to the hospital, and he was delirious. Let's just put it that way. But they gave him something that did something to like you have to be there like within so many minutes for them to do this in the ER with a stroke, and it saved his life, and he can talk and do all kinds of things now, because
Yeah.
I don't know what it's called. She called it the magic bullet.
It's a
Yeah,
it's a clot buster. So he probably
that's it.
formed.
That's it. That's what she called it. Yeah. But she did call
Yeah.
it the magic bullet. She said, you've got to get there early. And it
Yes.
saved his life. She was like, I
Yes.
don't, if that didn't happen, she says, they are so blessed that they were driving. She was driving too, that,
Yeah. Yeah. No,
that she gave.
absolutely.
So a clot buster, how fast do you need to get to a, I mean, that's not something they bring in the ambulance, right? So you need to get to the hospital by a
No,
certain time.
you definitely need physicians to administer that and to monitor you. Um, so you definitely need to be in the ER for that. So for
That's
that
fast.
reason, it's very important to recognize signs and symptoms of stroke. So I'm glad you brought that up, because there's this acronym that is supposed to help people recognize signs of strokes early, so they can go to the emergency room as soon as they're experiencing any of these things. And the acronym is called, really quickly, B FAST. So B for balance, if you notice an imbalance. E for eyes, if you're having any kind of visual acuities, visual changes. F for face, if your face is drooping. A for arm, if your arms are weak. And S for speech if your speech is slurred. So if you have any of these signs of symptoms, it's very important to go to the emergency room right away, because if you get that clot buster, it can potentially save your life and can result in 100% resolution of all these symptoms.
And it's really cool because I don't think he would have kept his speech or anything.
Yes. Yes.
And this is a highly, highly intelligent being.
Yes.
Her husband, I mean, he did like military good stuff. Like I can't. Yeah, I'm not allowed to say, that kind of person, right? Really intelligent, incredibly intelligent man, like IQ way, and served our country in just like you do more that you don't say thank you for your service. You say thank you for your sacrifice, person.
That's right.
And intelligence, like we're talking super intelligence, right? Get my little drift there. Amazing human being. And everybody we're all here with amazing talents, and we all deserve the clot buster. I feel like it's like a little superhero thing, but there's so much happening in the medical industry right now. And I shouldn't say industry, but there's one side of it that totally is, but Dr. Jackie's not on that side, but you know what I mean? That yes. whole, there's so much innovation happening.
Yeah.
Isn't it an exciting time? But I mean, you guys have to be going through a lot of work with all these changes, but it's exciting what's going on.
Yes.
And then the regulation of like, okay, how far does this go or not, but it's exciting. We're getting better things to tell us when we're in trouble, like better screenings. I'm hearing like mammogram, there's better mammogram screenings and things. And, I think it's like the clot buster is saving lives. And, I think people are scared of AI, thinking doctors are just going to not be there. And that's not true. None of these things work without doctors. And it's like a tool, right, for you guys. Am I right in that? I know we got to go,
Absolutely.
but it's a tool, right?
Yes, it is.
Still oversee everything.
Yes, right? Yes, it is a tool. But I agree with you. This is definitely an exciting time to be alive. I can't wait to see what the future holds.
That's right. So on those notes, those words, it's an exciting time to be alive. Take care of your blood pressure. All right, let's all go eat blueberries. Thank you so much, Dr. Jackie. Everyone, keep up with Dr. Jackie at Women and Heart Disease Book.com. And her book is out on Amazon. You can get it anywhere. And if you want your bookshop to have it, go ask them. Thanks, Dr. Jackie. Take care.
Thank you. Take care.
Thanks for joining us on Big Blend Radio's Heart Healthy Living Show with Dr. Jackie. New episodes air every second Wednesday at 12 p.m. Pacific Standard Time. You can keep up with Dr. Jackie at womenandheartdiseasebook.com. Listen to the shows at bigblendradio.com.